dental work is definitely a luxury in most countries. It's not, most of the time there's not socialized dental care. It's going to be a pay-as-you-go system. And so for most people, when you're talking about, okay, do I feed my kids or do I get a tooth pulled? It's going to be feed my kids. That's going to win every time. And so like last week, I mean, we're seeing people walk through and it's like, wow, you've got a lot going on here. And again, too, it's am I going to buy toothpaste and a toothbrush or am I going to buy food?
Today, I have the privilege to be joined by Dr. Bradley Edmondson. Is that correct? You have your doctorate, right?
Dr. Bradley Edmondson, that's what they're calling me now, I guess. That's word on the street.
So I've known you for almost 15 years now when I went on my first medical missions trip with you, with your organization. So your title is executive director, but you are the founder of Medical Missions Outreach.
Yep. So with my wife, she's the brains of the operation for sure. But yes, we founded MMO together back in 2005, August of 2005.
And has the medical background, which is the you're the one in charge running the organization. I mean, she's right there with you, helping with everything, but she has the medical background and you actually did not have any medical background at all.
Nope. So basically, back in 2003, we were living in rural Alabama. Kelly is bilingual. She speaks fluent Spanish, English. When we were living in Alabama, she was the only bilingual medical professional in our community. And our community had a large new Latino presence. And so as a result of her linguistic skills, most of the Latinos in our community became patients at her clinic. And one day the owner of the hospital just came and told her, I want to send you with a medical team from Montgomery, Alabama that's going to Peru. I want you to represent the hospital, go on this trip. To make a long story short, he ended up asking me to go as well. And that was our first exposure to medicine outside the U.S. And we just really felt...
What were you doing though?
I was pastoring a church at the time. And so that along with a few other small odd and end jobs, because it was a very small rural community, a very small church. And so that was our first exposure to medicine outside the U.S. And we both really were just overwhelmed by what we saw, both the needs of people, the lack of care for people, the opportunity to share our faith with people that was coming into the clinic. And so we just really began to pray, Lord, we don't believe this is by happenstance that we came here. What are you trying to teach us? What are you trying to show us? And so we, at the end of that week, we really felt like, hey, let's just stay here. I'll start a little church. You start a little clinic. We can live the rest of our life here. We're debt free. We have no kids. We'll ask them to sell our stuff, send it to us. Let's just stay here and do this. And, we began praying about it and we knew that was kind of crazy. We came back to the U.S., but continued to pray. The owner of the hospital ended up coming to us again saying, hey, would you go to Ecuador, represent us in Ecuador? So we did. We went to Ecuador the second year. Same thing, just really overwhelmed by what we saw, what we felt like we needed to do. By the third year, he came to ask us to go somewhere else, and we said, thank you for the invitation, but we've already called a bunch of friends, and we've got 28 people, and we're going to go help a friend of mine that started the church in the Dominican Republic and do similar, but with this specific church to help share the gospel while we help people with their physical needs. And so that's how MMO was started. And I think it was just one of those wonderful opportunities to see God merge our callings in life and our skills that He had given to us. She is a gifted practitioner. She's gifted in this medical field. And I feel like the skills that God has given to me is I'm more of a logistics, let's put processes in place, let's build something, and a little bit more of the visionary of how can we produce this over and over again and assist people around the world. And so what we honestly thought was going to be once or twice a year has definitely grown to much more than that. But that's how it came to be. She's definitely the brains and the beauty of the operation, and I just come along to carry suitcases and see what I can do to make it happen. That's all I'm good for.
So when you first started, and I remember when I went on the first trip, there was pen and paper, writing stuff down. And we just, before this, we went on a tour of the facility that you're in now, and it's big, and it's like just a very nice facility that you have. And you've, it went from being pen and paper, prescriptions and all this to now you have an EMR and you use iPads when you go over there. You have a full pharmacy. So how have things changed from the first trip to like what you're doing now?
Yeah, I mean, it is completely night and day difference. Now, I will say this: we don't get to use EMR in every country because it's not been translated to every language yet. We're working through that process right now, but we do get to take it to probably a majority of the countries we work in. But it's night and day difference. And a lot of that has to do with the fact that God has brought so many people to the staff that have skills and are able to see like, hey, what can we do? We're, a big thing for us. One of our core beliefs is to do everything with excellence. And so how can we do this in an excellent manner where it not only glorifies God, but it keeps our patients safe? It lends to the professionalism of what we're trying to do and accomplish. We tell people all the time, if you come on a trip with us, we're not mercenary medical professionals. We're not going to just go and, oh, hey, I've never done surgery before, but let me cut this out of this guy's arm. We're not we hear those horror stories all the time. We don't sneak into countries. We don't hide stuff in suitcases and try to show. It's changed where we have compliance people on our personnel. That's all they do is work with governments to get permissions to come into countries. Our dental team has, an amazing amount of equipment. We come in, we have a full dental suite where we can do ultrasonic descaling. We have mobile dental chairs. We have, all the hand tools and delivery systems. We have portable x-ray for them to use on the dental field. We have lab, we have pharmacy, like you say, all of these different things. So it's what originally started off, we thought we would do just episodic medical care once or twice a year has now turned into medical, dental, optical, surgery, physical therapy, public health education, soul care. So lots of different disciplines. We also have a beautiful surgical facility in Central America where we're doing orthopedic, general, GYN, podiatry. Very soon we're going to start offering cataract surgery. So, there's so many things that it's a night and day difference of what we used to do, all the way down to our team members who travel with us. Back in the day when you came with us, it was, let me pick up the phone. I'm gonna call Marcos. Marcos, what size T-shirt do you wear? I'm having some T-shirts made. Now it's this team members go onto a website now, and you go and build your welcome pack, and you can choose all these different things and journals, and just accentuating this to make it more of this really monumental experience that you're going to have, where you're getting to use your skill set and see the value of your skill set in helping other people. But also a big belief for us, or a big thing, is we don't believe you should separate your skills and your faith. We believe that those things are intertwined, and that God designed you on purpose that way, especially if you're a believer, to use your skill set to bring glory to God, to use your skill set to help other people know Him. And so we want to build all of these things together and have it in such a professional, seamless manner, so that when you get on this trip, all of your attention, all of your abilities are poured into serving other people and simultaneously watching God do something in your life. And so it's a much different operation than I ever imagined. Now we have, over 30 people on staff as far as missionaries and staff members that work with us. And it's far greater than anything I ever imagined.
Thank you for joining me on the podcast. Don't forget to subscribe and let me know in the comments who you'd like to see me have on the show next. So I remember going on the first few trips, and it was like, I feel like underqualified almost, because when you go over there, it was like you were given, I guess there's fewer restrictions on nurses. Mm-hmm. So what, and there was always a doctor there. So it's not like if something came up, there was a physician there that you could ask. But how do most of the nurses that that come on the trips handle like, because you're almost like prescribing when you're over there as a nurse. I mean, you're not prescribing, but it's more than you would do in a hospital here.
So I think the position we take is if you're not licensed to do it in America, we don't do it overseas. So there's a ton of collaboration that happens. So, the reality is the way our systems would work now is, a nurse comes. Doing assessment on a patient is very normal. That's a very normal thing for a nurse to do, is making sure, when a patient has complaints or discomforts or whatever, listening to them, taking a good history, charting that out. And there are some times where it's something very simple. Well, okay, you got a headache. Okay, let me talk to you about hydration. Let me talk to you about sleep. Let's talk about, lifestyle modifications you need to make as a hypertensive patient or diabetic. What medications are you on? What are you currently doing? Taking a good history. Then it's about going to either a mid-level practitioner or a physician and saying, hey, this is what I got. This is the history that I've gotten from the patient. These are some of their complaints. What do you think? What's the plan that we put into place? And so then that physician, that nurse practitioner, that PA is able to say, okay, based off of what you just told me, this is, I'm jumping to another situation. This is otitis media, so we're going to give amoxicillin. Here's how we're going to dose it out. And they sign off on that chart. And so there's always that collaboration that happens. So if a nurse is on a trip and it's something very simple, hey, just talking to them, they're just an 80-year-old and, they have musculoskeletal aches and pains. We're going to give them some Tylenol. We're going to give them some Tums. We're going to give them a few things like that that's over the counter. You could do that in the U.S. You could tell them some suggestions like that and do it. So you can do that in our clinic. But anything that requires an actual prescription in the U.S. is signed off by a medical professional who has a license to do that. So that's kind of the first check. The second check is that it goes to our pharmacy, and that's going to be someone who is either a pharmacist or someone with prescribing authority. That's going to be the second filter, checking that, making sure it all matches what you're giving, what you're doing, what the dosing is, or correcting it, going back to the collaborating person saying, hey, we're going to switch this to, change the dosing to, that kind of thing. And then the third check is when it's actually dispensed. There's another medical professional who's licensed, who's going to tell them what it is, what it's for, how to take it, and then work through those medications with the patient one last time. Again, checking through the chart, making sure everything matches up, that it's appropriate, so that we have this triple check system because of, first rule of medicine, do no harm. And that's what we want to do. So we want to do things the correct way.
How do you get past some of you said you have like a, I don't know, it's like a legal team, a compliance team. How do you open up a surgical center in another country? Like, is it running all the time? Is it just certain parts of the year? Like, how do you go about working with the government over there and opening like a facility?
Sure. So the surgical center in and of itself is a completely different animal. That's a huge beast. We actually do have lawyers that represent us. We have a legal standing in the country, and that was something that took years for us to get all the way through the process. And to be honest with you, we're still in the process. The surgical facility, God was extremely gracious with some fantastic financial partners that caught the vision of what we were wanting to do, how we were wanting to do it. And, several generous donors that came behind help us getting the equipment to the point where once it was constructed and equipped and the government came in to do, regulatory checks on what we had, what we were doing, it quickly escalated and multiple officials show up. And then the next thing we know, the president is sending people down to our facility. And, the word we were getting from our lawyers is this facility is nicer and has better equipment than pretty much any other facility in our country. So the government wants you to requalify not as a surgical center, but as a hospital now. And they began, asking us to do more. So that one was a very unique animal. And
so they wanted you there.
They definitely wanted us there. So that facility exists to help with overflow from a local hospital. There's one public hospital for 400,000 people in this community, and it's grossly underfunded. It's grossly under-equipped, and we don't have the finances to bring that thing up to par because it's a full-scale hospital. So what we, after just years of working with them and having visiting surgical teams, our our thought process is, instead of trying to pour into something that's broken, that's just going to continue to leak and never be able to fill, we should build something that's leak proof. Let's build this ourselves. Let's invite the medical professionals over to work alongside us. Let us teach them new surgical techniques. Let us have our own equipment that we can protect, that we can keep up to date, that we can, service as often as necessary. And so that's kind of how that idea was formed. And what happens is, in a system where it's socialized medicine, and basically, last time I checked, it's been a little bit since I've checked, but last time I was talking to our employee that lives in Honduras and works with the local hospital, we were told that they had not had anesthetic medications for over 6 months. So basically what that means is, if the patient wants to have surgery and the hospital doesn't have any anesthesia meds, they either have to buy them off the black market themselves, or they have to go to a private facility to have that done, or have surgery without anesthesia.
They can buy their own anesthesia and show up to the hospital?
Yeah, so that's a very common thing in underdeveloped countries, is to go in, especially if it's an elective surgery or something that they would consider not non-life-threatening, so like to have a hernia repaired. It's a very common thing for them to say, we'll schedule your surgery for, Thursday, 2 weeks from now. Here's the things that you need to go buy and bring in, because the hospital does not have these things available. That's a very common occurrence. They get a sheet, and just outside the gates of the hospital are multiple shops that sell stuff. You can, okay, I need to go over and buy my anesthesia circuit from here, and then I need to go over there and buy the sutures from there. I'll need to go back over here and buy IV solution and tubing over here, and collect all of these things from your order list, bring it back into the hospital the day of surgery in order to use it. And if you don't have it, you're not going to get it. They're not going to use it. So it's a very dangerous thing. It's, checking off a list and making sure, and, making sure you got the right thing. We know
that just sounds crazy.
It is. It's sad. I mean, that's the part that's just absolutely heart-wrenching, heartbreaking, that, in some of these systems, it's too corrupt, because there's too many possibilities for corruptions. You have hospitals that employ doctors who are supposed to be working in a public hospital, which is socialized by the government, but they also own private clinics, and their private clinics need supplies and equipment in order to make money for this doctor. And, where's this stuff coming from? Well, a lot of times it disappears from a public hospital only to show up at a private clinic or hospital and being used for profit over here. So there's all this corruption. There's all, it's very sad that at the end of the day, it's the people of the community who are suffering. So our thought process was, okay, we'll build this. And what we do is we have a social worker that works with the hospital social worker, and they're asking questions. Who's at the bottom of your list? Who's been waiting the longest for their hernia to be repaired, or has a gallbladder that needs to be removed? Who are so poor that there's no way they're going to be able to ever go to a private facility and get this done? Who's somebody that's on your GYN case that's been waiting for quite a while to have, some type of corrective surgery done or whatever. Orthopedics, who's somebody that's been needing to get their hardware removed and just can't afford that next step to get it done, and the hospital is not, assisting in this way. And so we're able to help those people. Currently, our facility is there, of course, year round, but it's not open year round. We're doing about 5 to 6 teams a year. And basically it's a pretty lengthy process just to even do those. So you have 1 month where you're just gathering cases and preparing. So, you have to go back to even the recruiting of a team. Getting people to commit to a trip is a big deal, to get American medical professionals, especially anyone in the surgical field, to commit to being gone from their practice for a week. So most of these folks are talking a year in advance, which is, that's helpful for us. We have an orthopedic and a general team that work together very well. The general surgeon, orthopedic surgeon, 2 anesthesiologists are always going to work together. They usually always work together in either October, November. So we can count on them. We build the rest of the team around them, the circulator, the scrub techs, all of those kind of people. We build around them for the PACU, pre-op team, all that. But we at least have those 4 committed, because those are probably the hardest people for us to recruit. So now we're able to say a year in advance, okay, we're looking for cases for this team. So once we have those lined up, we still have to go down and do H&Ps. So we have to send someone ahead to do H&Ps, make sure they're all good candidates. If they're not, we have to replace them. We usually try to build a caseload that's actually greater than what they can accomplish in a week, because inevitably something comes up. You might get somebody who ends up getting some type of cough, cold situation, or their blood pressure is just uncontrolled. They're not going to be able to go through surgery, whatever it may be, and disqualifies them. So we want to have more than enough work to do. Then you're doing the week of surgery. Then you have post-op care that has to happen. So we're bringing the patients back in. A lot of that is done by telemedicine. Our nurses are going to see them. They're going to check wound sites, make sure everything is looking good, making sure to get any lab reports back that we may need. But then also bringing the surgeons back by video. They're going to come on and do like a video conference with the patient, checking, talking through everything, make sure we're getting the desired results. So
is this run at the level of the other country's standard, or?
No, this would be more of American standard. Now, with the exception, there's no way we could afford to build a surgical facility exactly like the U.S. outside the U.S. Like the average OR in America, they say, is usually about $4 million per theater. And that's with basic equipment. That's not with, robotics and all that stuff, of course. Like, there's no way. Then you have all of the sterilization rooms, all that kind of stuff, anesthesia rooms, that just, the cost just, we have standards that are so incredibly high. And then there's backup standards to those standards, and there's defaults, and there's, plan Bs and all this kind. There's no way you can do that as a nonprofit in an underdeveloped country, but we do have standards that are higher than what they have. Like, we might not have a WAG system, a waste anesthesia gas system, but we do have a way to pipe out fumes, and we do have, but we don't have circulated air with multiple different filtered systems and all those kind of things. We have a way to move air. We can't have negative pressure in our rooms like we could in the U.S. So there's some things like that's not found anywhere in the country. Mm-hmm. You're not going to find a surgical facility anywhere like that. But hey, at the same time, I forget how many years now the surgical facility has been happening, and I think we're up to over 700 cases that we've had, and we've only had one infection out of 700 cases. So I think our infection rate is really, really good. We're doing very well. We have very high standards for our teams. We take it very seriously, and God has just protected like crazy and given just really great personnel, really great outcomes to our cases. So when we go back to your original question and we talk about compliance for the surgical team, that's completely unique versus our episodic visiting teams. So we have compliance teams here within our offices in McDonough, Georgia, where we're located, that are working a year to two in advance, depending on the country. And basically, it just begins with that call to the country's health department and saying, what does it take to have a visiting medical team come in? What do we need to do? And to be able to bring all of our own medication, all of our own equipment, supplies. We want to bring everything with us, because then we know, there's a lot of rabbit trails here. When you do work in other countries, there's the danger of getting black market medications that are not real, that are not name brand, that you don't know what you're getting. So we try to avoid buying stuff in underdeveloped countries, because we don't have a way to ensure the safety of the medications. So we prefer to take those things. Plus, we know there's other stuff that we have here in the U.S. that just exceed quality, and we want to have the best we can for our patients. So we begin asking all those questions, and they work through it all. I mean, if it's we have to license everybody. Remember when you traveled with us, you have a license in South America from Guyana. When you went, we had to get you licensed. We do the same thing. We have to work with the customs officials to get permissions to actually bring and import stuff. It's a really, really big deal, and it takes quite a while to amass all the information they want.
So now I'm sure in some of these countries you have a reputation of they kind of know who you are. But when you first started, were they like, what are you doing? Like you would, because you would show up with tubs and tubs of pills. And
Sure.
So are they like, what are these? We need to inspect every single pill.
Yeah, I mean, early on, we always would take inventory and have stuff available. But, when we first started, the whole electronic world was not what it is today. You couldn't just send an email and here's a submission of everything. We're communicating with our hosts and saying, hey, these are the things. Here's a list. Can you print this out? Can you take it down? Okay, well, now they want it. They want some type of verification. And it was extremely difficult. And I always, try to say this in a very polite manner. There's a reason why underdeveloped countries are underdeveloped. A lot of times the right hand doesn't know what the left hand's doing. There's not a clear, thought out process for everything, especially back in the early days. Now we're finding a lot more countries, World Health Organization and other large entities are trying to help these developing nations learn how to govern these things and how to have systems. And so it's gotten a lot easier for us. It's a lot easier for us to say, hey, the standard is, for our pharmacy, here's the name of the medication, the milligram strength of the medication, here's the lot number of the medication, the manufacturer date, the expiration date, quantity, all of those different things. Here's the lab results of when it was tested. We can provide all of this documentation because it's getting more and more to be standardized. And so we're able to do that. Back in the day, it wasn't that easy. It really was showing up, and it was, you have this man who may or may not even be able to read, who is just the customs official. And he knows I'm supposed to protect my country from drugs, but I don't know if these are good drugs, bad drugs, and I can't read this list. And you were kind of just at their mercy to talk them through who you are, why you're there, what you're doing. We would have tons of paperwork with us. Here's our licenses, here's our passports, here's, the invitation from our host, and here's the letter from the health department, and you're trying to provide all these things. And at the end of the day, you're really at his mercy or her mercy of whether or not they let you into the country.
You've been held, delayed, and stuff has been not confiscated, but it's been.
We've had stuff tested. We've had stuff held for a day or two while they go through it all and make sure it was legitimate. And that kind of stuff doesn't bother me. I mean, I would expect the very same from the U.S. government. If someone was coming in with a large amount of medications, I would expect them to say, wait a minute, why are you doing this? Is this legitimate? Let us check this out. But then at the end of the day, you are in a developing country. And so most of these officials know, I understand too, there are people who have needs here. And I recognize that these are people trying to do good. There's been a few instances over the last, decade of visiting medical teams from countries who actually came. They were a little bit rogue in how they did things and things that they used, and they actually injured and hurt people with bad medications. And it really gave a black eye to the medical voluntourism, as it's called, and by a lot of secular groups. And it made things way more difficult. But for us, we looked at it as this may be difficult, but it gives us an opportunity to refine what we do and have a better testimony, because we're going to do it the best we can, and we're going to lead the way and going above and beyond. And that's really, we've invested, there's been donors who see what we're trying to do in a professional, excellent manner, and they want to get behind that. So we've actually developed systems and protocol where we want to take this very serious, show license, show everything. And that way too, our host can be proud of who we are, that they can put it out publicly that we're there. There's no shame. There's no hiding whatsoever. And I believe in doing it that way too. I think it honors God, and the fact that we want to work hard. We want to be professional. It builds trust within our team members. People who are saying, hey, my license is on the line here. I want to make sure that we're doing this right. We're not doing something crazy. And so whenever I'm able to tell them, hey, you've got a license here, or hey, we carry malpractice insurance, we don't have to, but we do that. Whenever I'm able to tell people and show them the paperwork of all that we did to make this happen, they're able to say, man, this makes me way more comfortable. I want to travel with you again. I'm able to relax and just really focus on doing the best I can for the people that's here. When they start seeing a lot of the behind the scenes work that goes on, I think it helps everybody to just really exhale and not be as apprehensive or anxious about it, and just really be able to give good quality care to our patients. So I think it's a win-win for everybody that's involved.
Mm-hmm. Yeah, I've heard a couple of stories about smaller organizations just like that showing up unprepared. Like
Mhm.
you're not just showing up with a couple cases of Tylenol and throwing
Yeah.
it at the patients. I mean, it's a
Yeah.
pretty organized.
It's sad because it is sad because there's some people who they have this passion, they want to do something, but the mentality that they take is, oh, we're just going to pray and God will protect us and it'll be fine. And we're just doing this in the name of the Lord, so it's okay. And it's like I don't believe that's the right mentality. I think we have number one, you have a responsibility to do things ethically. You really do. So if the government would require you to get permissions, then work hard, get the permissions. Don't sneak in. How can you expect to do this in a way that's has an upstanding value when you didn't even start off the right way? That's a frustration that I have because in the end, you're hurting everybody else that's trying to do it the right way. So whether it's making sure you have the right people in the right position. I just recently was talking to someone from another organization, and they were telling me that they had 14-year-olds running the pharmacy. And I'm just like, I'm sorry, what did you say? And I'm like, explain that. And they're like, oh, well, we write it down really clearly, and they're just getting the medicine together and putting in the bag and giving it to the patient. My thing is, well, I'm 47 years old. I've been doing this for 20 years, and making sure that they understand the difference between loratadine and ranitidine. That's two opposite things here. Those are really big differences. And for a 14-year-old, it ends in "dine," isn't it the same thing? And it's like, no, those are completely different medications, completely different uses. That's dangerous. And so I think, again, having high standards, doing things right is so very important. That you're right that we, again, and I'm not trying to, don't take it the wrong way. This is not me trying to brag or anything like that. It's not it at all. It's more of seeing the importance of what we've been called to do and giving it absolutely our best. That's really what we want to do, because again, at the end of the day, we're doing this for a higher reason. There's more on the line here than just simply trying to help better someone's lifestyle. We want to make them genuinely know, doesn't matter what skin color you have, what language you speak, how much money you have in the bank, what your education level is. None of those things are important. Every single human being was created in the image of God. They deserve dignity. They deserve respect. They deserve the most compassionate, ethical care we can give them, so that at the end of the day, when we want to share our faith, or at least get an opportunity to pray with them, that they will find relief from whatever they came in for, their heart is open because they can see the level of care and professionalism we've offered to them, if that makes sense. I think there's a correlation there.
So what would you do with a teen? Because I know you've had teenagers come on,
Mm-hmm.
whether it's your kids or family members who
Yep.
go, and what would they do on a trip? Like not run the pharmacy, but
Yeah.
like blood pressures and
Yeah,
just
there's a lot of things that you don't have to have a license to do in America. We can have them stand at the triage and, hey, could you stand on this scale? Okay, they weigh 22 kilos. Let me write that on the paper. And while that might seem very trivial to people, when you're seeing 500-600 patients a day, every little job in this clinic has a lot of weight, and wanting to help the process go smoothly. I don't have enough nurses for there to be a nurse doing every single little job like that when I don't have to have one. As a nurse, you have a child come up, and the paper says that they weighed 42 kilos, and you're looking at this 6-year-old, you're going to know there's something wrong here. Let me reweigh this and correct this. It's not this life and endangering situation. There's things like that. Even having teenagers and kids help guide patients from one area of the clinic to the next is a really big deal, because we have a lot of people that show up. There's a lot of different areas. It can seem like a complex system to someone just walking in and seeing all of this and being overwhelmed. So having people assist people to areas. We've begun teaching teenagers who are mature how to give a visual acuity exam. That's very simple. Can you read this line? Can you read this line? Once you find out, okay, they've missed 3 out of the 4 letters on this line, then we need to just mark it down. This is where they read to. I'm going to mark this on the paper, and then I'm going to pass it off to the people who know what they're doing. They can you take all of this information and put it together to really hone in what this patient needs. There's just things like that that can be done that are, whether it's pulling the medicine off the shelf for the pharmacist. They're not actually filling prescriptions whatsoever. They're just helping to move things back and forth so the pharmacist can do their work faster. Let me deliver these things to the nurse so that she can hand them out. Things that, again, I believe are held to a high standard. We're not putting anyone in danger. We're being very responsible. We're educating them on what they're doing and how they're doing it and why they're doing it so that we can have just a really good, safe environment for our patients.
It's similar to maybe what a volunteer would do in a hospital.
Yeah, absolutely. A candy striper, anybody like that, they absolutely get to do these type of jobs. And it is some on-the-job training. The honest truth is we've had a lot of teenagers that have come on trips who never once ever considered medicine as a career field for them, but they came with their family on a missions trip. And at the end of it, it was like, wow, I didn't know being a nurse could be so much fun. I see how this helps people. And we literally have teenagers right now in nursing school that came with never ever thinking about that, and now it's a career choice for them, and that's amazing to me. That's a result of something that's bigger than we ever thought it was going to be.
What are some of the conditions like over? Because you've toured hospitals in other countries.
Yeah.
I know some of them are better than others.
Sure.
But what are some of the conditions that you see that would, I guess, the average American just wouldn't realize
Sure.
This is what the hospitals look like over in another country?
Yeah, so I think, right off the bat is you're thinking you'd have to understand that a lot of equipment is probably going to be in most underdeveloped countries in a public hospital setting. You're looking at equipment that's going to be on average, I would say, greater than 15 to 20 years old. So you're seeing a lot of just really older, outdated equipment, which in some ways that's really good. You get some stuff, instead of having digital everything, getting analog is actually really good in developing countries because you don't have biomed techs that can come and recalibrate and fix and, replace the motherboard on the computer on this thing. Like our anesthesia equipment that we have at our surgical facility, I don't want digital. I don't want the big computerized things because it's way too complex. I cannot get it repaired there. So even for some of our anesthesiologists, we actually have a pre-webinar before the trip. There's a pre-trip webinar where they're going to be told, hey, this is the machine we have. We have a narcomed. This is the model. We'll send you some information so you can see it. Most of them are like, oh, okay, this totally makes sense. I know how this operates. It's just that I have to flip this switch versus a computer doing it for me. It's very simple for them. It's just more of, I've not seen one of these before, but I absolutely know how this works because that's their field. That's, what they do. And so when you get into some of the hospital settings there, though, you're looking at stuff, very common to go and see. There is no such thing as private rooms. You're going to see rooms that are multiple, way more people in a room than you would expect to see. 6, 8 beds in a room, no sheets on beds. Beds are rusty. Very common thing to see, either really old IV poles that are, just bent or, rusted, or even nails in the wall holding up IV bags, to understanding that most patients in hospitals in those settings, the nursing care is definitely different. There's no meals being offered. There's no bed baths being given. None of those things are happening. If your family doesn't bring you food, you don't eat. If the family doesn't come to bathe you, you're not getting bathed. They are just simply there to keep you alive and get you out the door, as soon as they can, and just to dispense your meds or whatever you may have. And again, that even depends on your family buying and bringing the meds in. It's extremely different.
No patient satisfaction surveys.
No, there's no patient satisfaction surveys. You're not worried about whether or not the insurance company is going to pay out, based on what they felt of their experience. So it is very, very unique. Most hospitals, very few wards will have any kind of air conditioning, doors open everywhere, animals, dogs kind of wandering in and out. I mean, it's very unique. And what's sad is Americans, we have this we have this entitlement and we have these expectations of, you've seen billboards that say, you're driving down the highway and it says the local ER has a wait time of 7 minutes. Like, that blows my mind. Why are we advertising the wait list, the wait time of a ER, down the road? Well, it's because we're entitled and we don't want to wait, and we want things, we want it now. And then we get mad if we have to make a co-payment, and we get mad if the nurse didn't answer the call bell immediately, and we get mad if this didn't happen, whatever. And most people don't understand what people are going through in an underdeveloped country, that they just want to be find relief from this pain. They just want to be seen as a person. One of the things that we find that happens often in our clinics is the fact that we talk to our patients and allow them to have some input as we develop care plans. That's unheard of for most of them. They're very used to walking in, the symptoms being told to the doctor, and then really not getting to do much talking. The doctor tells them everything that's going to happen, how it's going to happen, and what he thinks, and then that's it. That's what happens, whereas we're asking and talking and trying to get more information. And do you feel comfortable with this? And how would you feel if we were able to give and do, and allowing them to have input? And as a result of that, they feel seen, they feel heard, they definitely feel loved. And so there's things like that we bring to the table that they're not used to. They don't see in a hospital. They don't see in their care. And again, I feel like I'm painting with a really broad brush here. This is not every single country, not every developing country is the same, but we do see there's lots of commonalities in a lot of the things that I'm saying.
So what do the local physicians and nurses think when you come into town?
For the most part, I would say most of them understand why we're there, and they support us being there. We actually invite anyone from the medical community to come out, work alongside us, come and help us, come sit with us if you'd like to see how we do things, how we treat people, what medications we prescribe, and how do we prescribe it. We are very open to them coming and participating with us. We love it because there's a lot of times, hey, we may need a referral. We need to find out how the system works here. Last week I was in Madagascar, and being able to ask medical professionals, okay, this little boy has a club foot. Do you have an orthopedic surgical facility? Is there pediatric orthopedists here? What do you do to get them into the system? Is this even possible? This person has a newly diagnosed hypertensive patient. Who can we send them to? Do PCPs handle this? How does that work? So we love asking those questions and being able to work with them. And so for the most part, they don't feel that we're there to threaten them at all, because number one, we're short term, but we also are using our opportunity to hopefully bring this undergirding of what they're doing, and being able to tell people, hey, yeah, what your doctor said is right. You do have hypertension, and you do need to change what you're eating. You do need to exercise. This medication is appropriate. You should be on lisinopril. You should be taking it, the way they're telling you. You're good to go. We'll give you another 30-day supply so that you don't have to buy it, and you can start saving up more pesos. So at the end of the 30 days, you're ready to buy your next, 30-day supply. And then a big thing for us is education. So we actually have nurse educator stations now. So any patient that has any type of chronic illness has to go to a nurse educator. Here, we have materials, pamphlets, pictorials. So in case they are illiterate, where we're teaching them lifestyle modifications, teaching them
like heart failure.
Yeah, teaching them, going through all of these things to show them this is what's going on with you, because we're blessed in America to have had health classes, and we may not have called it this in elementary, high school, but we were learning microbiology about washing our hands and, all the different things about unclean water or whatever it may be. So we're having to do some of these educational points for people, teaching them. So a lot of the doctors appreciate that we're able to say, yeah, keep going to your doctor. You're doing really good, and keep on this plan that you have. For some people, it's just getting a second opinion. My doctor here says that I need to have surgery. Is this true? Yep, you do. You do need to have surgery. You need to keep following up with this, and hopefully you'll be able to get on the list and actually have surgery. So for the most part, I would say most medical professionals in underdeveloped countries are very happy to see us because, again, we're not there to replace them. We're hopefully helping to give a little relief to an overburdened system. They don't have the medications. They don't have the time. They don't. Most underdeveloped countries do not have anything like an urgent care system. So for us to take some of those cases for them, I believe provides relief so that they can concentrate on maybe some of the more complex cases for that week and really devote their time and energy to that. Because we're, on average, we're going into communities, and I think our average right now is like 23 to 2,500 patients every 4 days. Hopefully they can see a relief in their community, that there's been some help there.
So what can you walk us through and when you go on a trip, you leave and fly to wherever.
Right.
What's the rest of the week like? You get into the airport, and for a lot of people that go on a trip, it's the first time they've ever left the country before.
Mm-hmm.
And so it's like they're not used to, it's not just like flying to another city in the United States
Right.
and you get off and there's a lot of logistics. And so when you land in in another country, what's the rest of the week like?
Yeah, so we'll gather together in that airport wherever we land. We gather together. We get all of our supplies, equipment. I try to stress to everybody, we're a team. We do everything as a team. We're going to stick together all week. So they're going to wait. We're going to get everything together. Go through customs together. Get on the bus. Go to the hotel. Get some rest. So I'll give you a quick rundown. Last week when we were in Madagascar, we landed late Friday night. Get to the hotel late Friday night. Saturday morning we get up. We had an orientation. So we do a lot of pre-trip webinars for everybody. There'll be an optical team webinar, dental team webinar, medical team webinar. We do a general team webinar. We really want to help people feel comfortable and feel like they, understand everything that's going on. They're getting, all of our medical professionals get a packet in the email that's a clinical packet. This is the system that you should expect, and here's things that you should be prepared to do. And so they'll get a lot of information like that. So Saturday, we do an orientation. We talk about everything from what clinic is going to be like, how it's going to be structured, all the way to here's the way you need to behave and protect yourself in this country. These are things to keep you safe, things that you should not eat, brushing your teeth with bottled water, don't flush toilet paper, just all those kind of things that they need to know. We're going to exchange money, whatever. So then we do that. Saturday, we usually do a clinic setup where we're going to go to the clinic site, actually set up stations, make sure all the equipment is put up, the optical center is set up and ready to go. Have dinner, of course. Sunday morning, we go to church. We love worshiping and getting to experience church in other countries. I think that's just one of the most beautiful things and one of the greatest blessings that I think I've gotten to receive out of this is just seeing the body of Christ around the world.
One of the funniest stories I remember when we had a layover in South Korea. We were going to Cambodia.
Right.
And we went to church that one Sunday.
Right.
And they had that glass. I don't know if you remember, they had like this glass pulpit and they had these glass chairs
Right.
that you were sitting in.
Yes.
That was wild.
It was, and I think that's just so neat, just getting to see the differences. And I love listening to people sing in other languages. And it's like, oh, I might know this tune, but I don't know these words. And just sitting there enjoying that and watching and experiencing that. So we do that Sundays. A lot of times on Sunday afternoons, we do what we call a soft clinic open, where we will treat all the church people and people who are volunteering to work with us. So twofold, those people don't have to worry about if they're going to be seen or not, or if we're going to have enough medications and supplies by the end of the week. So we treat them first. That way they can concentrate on working alongside us. But for our team, it gives us that soft opening of, hey, no pressure. There's not hundreds of people outside in line. Let's go slow. Let's make sure we all understand the flow and how this works and ask any questions that you need to, work out any kinks that we may have. So that'll be Sunday. And then really Monday through Thursday, that's when we hit the ground running. We get up early in the morning, have an early breakfast. We always have a time together as a team where we'll pray together. Your team lead, whoever the team lead is that week, will go through. We have a journal. Everybody gets a journal, and there's a section of the journal that really is just some scripture passages and thoughts that they start 3 days before the trip to help you prepare mentally, spiritually for what you're going to do. and then they continue throughout the week where you're on the trip. And then 4 days after the trip, there's follow-up stuff for you to process what you saw, what you experienced, and how you're going to use those things in life now after your experience. So, but during that week, there's things that you'll read on your own, but then we come together as a team and we accentuate that. We talk about it a little bit more as a team before we start clinic. We have a time of prayer, and then, man, that clinic door opens and it is game on. It's, usually we're working 8 to 5, 8 to 6, depending on the crowd size, what's going on. So it's good. We are not a vacation organization. You're not going to come and just get to lounge.
It's busy
around.
from open to close.
It is, but it's fun too. It's a good busy. Man, the day goes by fast. It's like, man, I felt like we just opened and now we're already closing. And you've seen, hundreds of patients, and it's been really this wonderful experience. So we do that Monday through Thursday. And then usually, depending on the location, the country, travel time, all those kind of things, most of the time on Friday, we have like a touristy day. I don't want to take you to the other side of the world, to this other culture, country, and you not get to experience what it's like. So, Fridays, you go to Kenya, you're going to go on a safari. You go to Madagascar, we went to a lemur park and went to see, we do souvenir shopping. We've gone to volcanoes. We've done bungee jumping, zip lining, just, all kind of fun stuff in these other countries. Enjoy the food, the culture, just really have a good day to relax. Usually that day we're going to sleep in and get a good night of rest. And then either fly out late Friday night if it's a red eye back to the U.S. or early Saturday morning. Our desire is by Saturday night, we want everybody to be home at their home airport, hopefully in time to get to their house. Lord willing, there's no issues with flights, connections, luggage, any of that kind of stuff. Get you home because we also know most medical professionals, they don't get to take weeks and weeks of time off. And so we want them to have a day to rest and kind of begin the recuperation, get them home where, if, they can go to their home church on Sunday morning, enjoy just, praising God for what they saw and what they were a part of, and then get some good rest Sunday afternoon and be ready for Monday, work. So that's how we usually try to roll for our typical episodic clinical teams.
What was this? Can you tell me a story about the dentist that you were talking about earlier that was there for a week? And because you have you do dental dental and vision as well as the medical
No, so optical and medical are pretty much offered on every trip. Optical actually does their own independent trips as well. So there are some countries and clinics where there's nothing but an optical clinic happening. Dental is growing, and we've definitely probably doubled, if not tripled, the amount of dental teams going out. God has been steadily blessing and giving us the financial opportunity to buy more and more equipment. That's one of the biggest holdups, is being able to have enough equipment to send out multiple teams. So we just got home Saturday from Madagascar. Our dental director and his staff will come in this weekend, make sure everything is packaged, again, ready to go, because the week after they leave for Cambodia. So they're going to go to work and bring it again. So having enough equipment, supplies, and then also the network. We need way more dentists. We need more hygienists, more dental assistants, so that we can do that more often. But yeah, so last week our dental team was doing just tons of extractions, tons of cleanings. All of that kind of stuff is very time consuming. And so we have to not only be prepared before clinic opens. How many do we think we can do? How much equipment do we have? How much time do we have? Because every patient, can be different. Sure, they want an extraction, but man, as soon as I touch that tooth, it shattered, and now I've got to dig out all these roots. Versus, that one I had barely touched it and it came right out. They were done in 30 seconds, and we got them out the door. So it can vary. We usually, when it comes to cleanings, it's usually time based, and we're going to give you 15 minutes. And our hygienists can do a ton in 15 minutes. They can really go to work and help remove a lot of calc and stuff in 15 minutes. We got great equipment. God is blessed. Our hand tools, our piezo, everything is just, man, it's really fantastic equipment. Aseptico is a company we work a lot with, and they've given us some really great equipment. And so as we grow that, it's going to be great. But yeah, our dentist, I mean, I think our last day of clinic, the dentist pulled like 89 teeth that day. Like it was insane. Some people, it was multiple teeth, 3 or 4 teeth. We try to be very careful how many teeth we pull at one time. Sometimes we'll pull multiple, but we'll ask a patient to come multiple days in the week, for pain. Want to be very careful of infection, all of those kind of things. So we're very careful how we do it. But we've got some people who are just fantastic. I think that's another one of the great blessings is I get to rub shoulders with some of the greatest medical professionals in our country that travel with us, and people who are just committed to excellent care and selflessness, willing to just really give of themselves and work very hard so that our patients feel loved and cared for.
Mm-hmm. And most of the people, like getting the teeth extracted, they just can't afford it, or they're on a long wait list.
No, so dental work is definitely a luxury in most countries. It's not, most of the time there's not socialized dental care. It's going to be a pay-as-you-go system. And so for most people, when you're talking about, okay, do I feed my kids or do I get a tooth pulled? It's going to be feed my kids. That's going to win every time. And so like last week, I mean, we're seeing people walk through and it's like, wow, you've got a lot going on here. And again, too, it's am I going to buy toothpaste and a toothbrush, or am I going to buy food? I think where we were in Madagascar, they were saying that the average daily wage in Madagascar is like $2.50 a day. So, I mean, it's not rocket science when you start doing the math and you're talking about just basic necessities for family. That's not a lot of money. It's not going to go very far. So you're definitely going to be very selective of what you're using that medicines for. And sometimes your health takes a toll, and dental work is a big part of, dental procedures definitely is going out the window. And then we also know too, your mouth is so important to your overall health. So again, trying to educate, you have to brush your teeth. Every patient every clinic, every patient's going to get a toothbrush. We try to give everybody a toothbrush. The dental team is, again, going to do tons of education and helping them to understand what's going on. We give, antibiotics prophylactically. We're going to give them, analgesics for, the procedures and everything. But we want to help people as much as we can, and teach them why caring for your teeth is so important, why you need to do it. But I would say when you look at all of the disciplines of care we provide for our patients, dental is probably the number one sought after thing, and it's probably the discipline we can't offer enough of. We never can get every person in line through the dental clinic. This past trip, I forget, we turned away hundreds of people. It was just impossible. And our dental team worked, I mean, they were amazing. They stayed longer, they worked harder, and yet they still couldn't see everybody. And so for us, our prayer has been what you said earlier. While it wasn't right, we want to get dental in every clinic. That is our desire. We just don't have it yet. So we have been praying for God to not only provide more people in our network to volunteer and go with us, we're also praying for full-time people, that God would, lay it on some people's heart to say, hey, I'm getting close to retirement, or could be someone that's in the middle of their career that just says, there's something greater out than just making money and having a huge practice. I want to be a part of something like that. We're 100% praying that God would send us people where it could be on every trip, people going every single time, and developing there's countries, just like we send optical only, we would absolutely do dental only and just do nothing but dental work and send. I was actually talking to our dental director, said, man, wouldn't it be amazing if we could have like 5 dentists, 10 hygienists, 10 assistants go into these countries and nothing else is happening at this facility except for a dental clinic, and how many people could we help and provide relief and care for, and how amazing would that be? We have big dreams. We have lofty goals of doing stuff like that in the future, though.
Is there like a bucket list country that you haven't gotten into yet that that maybe you've been trying to, or you just want to get into that you haven't been able to?
Yeah, there's a string in Southeast Asia of countries that I've prayed for God to open doors, and so far it hasn't happened. I would love to get to Bhutan, Laos, Vietnam, that whole area. Those are all pretty much closed countries. Myanmar, closed to Christianity. And at the same time, huge needs for care. Our thing is, we only go to a country when we're invited, and we will only accept an invitation from a local church. So that does make us a unique organization, but we believe so strongly that our faith is what drives us, that if we can't share our faith, we would prefer to, say, hey, listen, there's other groups. They're fantastic. Doctors Without Borders, boy, they're fantastic. They do great work, and they have deep pockets, and they can go pretty much anywhere. Call them, let them come to your community, if it's a politician that calls us. But, when there's missionaries in churches, and we know, hey, not only can we come and serve, share our faith, but when we leave, there's a body of believers there that will continue to work and assist. Most every church we go to, we will talk to the church and even help them start a benevolence fund. Hey, we want to give you $500, put this in a benevolence fund for your church. Ask your church people to contribute, to be a part of this. And, these two families that came, in probably 6 months, they're going to need more help. They need to be able to come here and get it from you. I believe that that's what the Bible teaches us. We're not to be dependent on the government. Churches are supposed to be the people helping. We're supposed to be the people loving our communities. We're supposed to give sacrificially as believers through our church so that our church can do more in our communities. And so we want to help those churches have those opportunities. We want to build those relationships. So unfortunately, in some countries where Christianity is outlawed, that probably means we won't have the opportunity to serve there, but it doesn't keep me from praying. There are some other countries that I would say are more open. I've prayed for years to go to Suriname. I've prayed for years to go to Equatorial Guinea. My wife and I speak Spanish. It's the only Spanish-speaking country in Africa, and I would love to go there and be on the African continent, be able to communicate with the patients there and help a local church. There's several Portuguese-speaking countries in Africa we've prayed and asked God to open doors for, but I would say at the top of my list, though, would be those Southeast Asian countries. I don't know why, but those have just been some that I've prayed for probably the last 20 years to be able to go and serve the people there.
So from what you know about the healthcare system here in America and what you've seen overseas, what are some things that we do well here? What needs improvement, and how do you, from just your experiences, how do you achieve those things?
Yeah, I would say number one, I'm so thankful we're not socialized. I know there's a big call and people think that we want that, and they will point to multiple countries and say, oh, socialized medicine is working there. France, Canada, all this stuff. But the honest truth is, if you really do this deep dive analysis, and I've traveled to 90 countries, that's something I love to look at. And while I'm no expert, I'm not going to sit here and try to claim that I am, and I have, just all this data collection on it. But from my anecdotal research and just really it's something that I do, I am very passionate about wanting to learn and make sure. I've never seen a country that can have the quality of care, the standards that we have for keeping people safe. And while we do have some flaws, and sure, some things may be bloated as far as, cost and efficiency, those kind of things, at the end of the day, I would choose to have all of my medical care done in America in a heartbeat. There's zero doubt whatsoever about that. I think some of the things we need to change, we do need to reconsider the way that we have commercialized medicine in America. I think it's a sad thing that we have commercials where you as a patient, go ask your doctor to put you on this medication. We're asking people who have no medical training to then just because I heard that it could help in this situation, to now put pressure on a doctor to say, okay, let me write you for that prescription just because it had a fancy commercial and you heard when there could have been a better drug. And, we want to make sure that the patient is satisfied, like you were even kind of joking about earlier, where, did you feel like they achieved everything that you needed done? And we're putting this undue pressure on our medical professionals, our nurses, overstressed, overburdened, more patient to nurse ratio than should happen. It's not a safe environment. We do compensate our medical professionals well in America. I think sometimes when we talk to medical professionals, they would say no, but the reality is they do get compensated very well. But at the same time, they're put under so much undue pressure that it feels like the compensation is not enough. And that's something that could be rebalanced. I really honestly think that needs to be restructured. Administrators, hospital administration need to, even government officials need to look at this. And again, I'm not for more regulation necessarily. I think I'm more for common sense. How can we go back and look at this and appropriate these responsibilities better? But again, sometimes the frustration of how far the bar is set for standards of care by our officials seems overbearing, but at the same time, we have something really good here, and I'm very grateful for that. I think my wife would tell you the nightmares that wake me up in a cold sweat, my heart just beating out of my chest, are the dreams where I'm injured, incapacitated, and I was in a third world country, and somebody was about to do something to me that I had no control over in a hospital that I've seen. You know what I mean? That is a legitimate fear of mine.
You passed out on a trip that I was on.
Yeah, I did. I had a vagal reaction there to something. I have, but I'm telling you, like, a MVA in a third world country scares me to death, because, going in and having any type of surgery, having any type of, something happen, that's a legitimate concern, because I've seen too much, and I don't, I want to make sure that unfortunately, I'm an American. I do have a little bit of access to, a financial opportunity to put me to a private clinic, and I would want to go to somewhere that I could feel more at ease and trust, because I've seen too much. So I think Americans, we have entitlement, and a lot of those kind of things that we need to stop and just be grateful for what we have, and spend more time thanking people, being more patient, being more kind to people who are assisting us, helping us, and vice versa. I think our medical professionals too, taking deep breaths and understanding stress factors, anxiety that people are having, pain that they may be in that causes them to be an irate, irritable patient, and just taking a deep breath and walking through that patiently, and the kindness on both sides of the table could make for a better experience for everybody.
I think every healthcare professional and patient should go on a medical missions trip.
Yeah,
both
absolutely.
Because I think both sides could benefit. The healthcare
Absolutely.
workers could benefit, and the patients could see what the conditions are across the world.
I think, we see commercials for like Operation Smile. We see, Doctors Without Borders. We see some of these, Samaritan's Purse. We see commercials usually around the holidays, and you've got a kid with a cleft palate, or you've got, someone with a orthopedic need, whatever it may be. And we may see these pictures, and at the time, our heart is just like, oh yeah, I'll give some money to help those people, go help that. But what they don't understand is the need, and the reality is so far greater than just those few images. And to go and experience it, we were in Madagascar, and we had people who had never been outside the U.S. that decided this, or I shouldn't say, this was their first medical missions trip. And I told them, you're absolutely jumping in the deep end of the pool here. You're about to see things that you did not expect, that will blow your mind. To realize, and I said, emotionally, you need to be prepared for this. Mentally, you need to be prepared for this. It's going to change you for the rest of your life. And you know what that is? Like you said, it's good. It's very good for them to see it. It's good for non-medical people to volunteer and go with us, do what they can to assist, and come back just thankful. I'm thankful for what I have. I'm thankful for my opportunities. I'm thankful for the blessings that have, surrounded me in my life. And as a result of my gratitude, it'll change my attitude to treat people with more kindness, more respect. And like I say, both sides of it. For our medical professionals who go on our trip, a lot of times they come, and I talk to people who are just burned out. I'm tired of the demanding patients. I'm tired of the demanding administration. I'm burned out by all of it that's going on in our country. And then they come on a trip with us, and for them to sit across from somebody who just begins crying and thanking them profusely, and, coming back, I just had this patient, and they don't even have money to buy shoes. And they came back today, and they were so grateful. They brought me 3 oranges. And for them to finally, it's like this connection is made of what that means, the value of just something so insignificant to us, but to see this gratitude and this love renews a lot of a desire to continue serving people again in the medical field. And that's one of those things we do. We talk to a lot of our medical professionals. Okay, listen, last week you had all these people pouring out love and thankfulness for what you did, and you're about to go back into the lion's den where they're going to be mean and they're going to be arguing and combative and all these kind of things. Take a deep breath and just remember, you have a skill set. I tell people all the time, being a medical professional is a God-given skill set, because not everybody can handle the blood, gut, sights, and smells of medicine. Not everybody has a mental recall to know what to do in those situations. God gave you that skill set, and so use it. Keep that in mind on a daily basis. I'm going into this, and it might be a difficult day, and I might have some people who don't appreciate me, but you know what? I don't do this for them. I'm doing this because he gave this to me. It's something he's entrusted me with. I want to glorify him. I want to help people to the best of my ability, and I'm going to ask him to help guard my mind, guard my heart, guard my mouth, and just serve people the best I can. And so, again, going through these trips, it's life-changing, it's life-altering, and I'm grateful. I'm grateful to be able to introduce people to this, for them to experience this, as well as on the other side of the coin. It's a two-edged sword, really. It's helping our people who travel with us, but seeing those patients helped, man, is it such a huge, huge life-changing thing to be able to bless people that way.
Mm-hmm. Before we go, can you let everyone know how to get a hold of you or Medical Missions Outreach if they want to go on a trip, or if maybe mention the kinds of donations that you take? I know you are always accepting like glasses and things like that, but there's some things that maybe you don't want sent into medical missions.
Sure.
So how do they get a hold of you, and just some things that if people are looking to get involved?
Yeah, so there's a lot of ways you can get involved. First thing I would say is, if you're just learning about us today, I would encourage you to go to social media, Instagram, Facebook, search Medical Missions Outreach, find our pages, go watch some videos, look at pictures, read some of the things there. I think it's a good way for us to be introduced to you, and you to really find out what it looks like, what it's like for our ministry and how we're serving. Then I would tell you to go to our website, tons of information there. Go to the FAQ page, read the questions that are there, learn about what it's like to travel with us, consider going. If you're somebody who says, well, I don't know that I can go, but I still want to be a part, we definitely have multiple programs we'd love to get you involved with. First is, like you said, our eyeglass recycle program. We need over 100,000 pair of glasses a year to have a proper spectrum of glasses for the patients we're going to see. Every clinic, we take 5,000-6,000 pair of glasses that are glasses we bring in that are used. We clean them, tighten them, straighten them. We run them through lensometers, get the exact prescription strength. We bag them, categorize them in 1/4-inch diopter boxes, and then we're taking them out, fitting them to faces. We also have another supplemental set of glasses that's a new system. Basically, it's empty frames with lenses that can snap in, where we can create glasses in case we don't have something to fit someone. So you can be a part of helping us collect, or if you even want to give to help us buy new glasses for people, that's a huge help. Again, you can find that on the website, the Eyeglass Recycle Program. Another one that's really fun, this one is a tongue twister. We have what's called a Prep-A-Puppet program. So every pediatric patient, instead of them getting their medicine in a plastic bag that's going to end up in a landfill on the ground in an already overburdened country full of garbage that needs to be cleaned, we want to give them a felt puppet that just says Jesus loves you. And I think we have 16 different animals. They're really cute. The patients always love these things. But what you can do is you can request from our offices to send you a box full of these puppets, and every puppet will have a card in it, and it'll tell you all the different over-the-counter medications that we need, and you can help us where we don't have to constantly try to find financial resources to buy these things. Your Vacation Bible School, your local school, your Boy Scouts, your small group, whoever it may be, can get together, and you can order as few or as many of those puppets as you want, get those cards, fill those puppets with those medications, and just pray over them, send them to us. We'll put them into our inventory and then get those to our smallest patients. We have a lot of different programs, and we have a lot of different needs. And so those are two that jump right off the top of my head. I would encourage you to go to our website. At the bottom of the homepage, there's a contact form. And just drop in that you want to receive a copy of our magazine. We have a magazine comes out twice a year. Tons of fantastic stories, beautiful pictures, just to keep up with what's going on in our ministry. And once a year, usually our end of the year, there will be a catalog at the back of it. And you can look and say, for $34, I can help sponsor a surgical case. That $34 is going to allow us to buy a surgical a pack, all the things that we need to do surgery, help provide the anesthesia, gas, oxygen, those kind of things for one patient. You could pick something like that. You could do a mother.
$34 for one surgery.
Yeah. So we, Emory Hospital, Emory University has allowed us to partner with them, and we are able to purchase our stuff through their purchasing agent, and it's at an extremely discounted rate. And so I think that's right. I'm kind of shooting from the hip. I don't know. I think that's what the cost is, but it's something like that. We have mother-baby wellness
Well, it's not
packs.
like $5,000
Definitely.
like when you get a surgery.
Nowhere close. It is absolutely affordable. That's what I should say. I shouldn't probably give an exact dollar figure. It's extremely affordable. But there's other stuff, mother-baby wellness packs. There's dental things, and we always have other projects too. You can go to the website, and there's a wish list, things on Amazon that we need regularly that you could just say, hey, I'm just going to get something off the wish list. It'll drop ship straight to our office, and it's a massive blessing to us. Or if you just say, hey, I trust you guys, you can check out our ECFA rating. You can look at GuideStar and find out that we are very much responsible with the money that's given to us. It is going to go to patient care. We do not have this massive overhead where people are giving $1.90 goes to payroll here. That we don't operate like that at all. We're very razor thin. In fact, the majority of us are missionaries who raise our own money to be here. So the money you give is going straight to patient care. And you could just go and just say, hey, I'd rather just give you a donation and let you, get what you need. That's always a huge blessing to us. But we definitely, the way the ministry has grown, the amount of care we're trying to give, our needs list is massive. It really is. And so at the same time, God has always provided. He's always brought great partners to us. And so we rest in that. We're not worried about it. It'll happen when it happens through who it's supposed to be given through.
Mm-hmm. Well, yeah, thanks for that. And I think hopefully a lot of people get involved and,
I would love that.
Do something just to help out. So
for sure.
Thanks for coming on and just telling me about your medical missions outreach. And, we'll have to, me and my wife will have to get back on a trip. It's been too long.
Absolutely. I think you should do another episode on the field. I have to record another one somewhere around the world. But yeah, thanks for giving me the privilege to be with y'all today.
And if you heard any scratching, there's this iguana. What's his name? There's a giant cage over here. What is this? The MMO mascot?
He is. He's our mascot. His name is Don Miguel. I came home from out of the country, and he was here. When he first came, he was a baby, very, very small in a tiny cage. And now we're in a cage that's probably 7 foot tall by about 5-6 foot wide. He's much larger and much more grumpy sometimes. But yeah, he's our unofficial mascot. Actually, I guess it is official because in our online store, there's actually plushies and stickers and all kind of stuff.
Is that what that stuffed animal was out there?
Yeah, that's Don Miguel. That's the Don Miguel plushie there. So just a fun thing. He actually also makes some appearance, and if you go to our website, I believe there's a video or something on there. One of our commercials I know that we've done for Prep a Puppet where it's Don Miguel. It's a animated. He has his own puppet that I was talking about. Kids can get a Don Miguel puppet. And so it's animated, talking about the puppet program there. So anyway, yeah, he's lots of fun.
All right. Well, thanks for coming on, and I appreciate the conversation.
Yeah, thanks for having me. I hope you have a great trip to see your family, but thanks for stopping by to be here with us at the concourse.